This is Open the Door, a podcast by Habitat for Humanity International. Life starts at home, where families grow and futures are built. Housing isn't just a roof, walls, and a door. It's health, education, safety, and dignity. In this series, we hear from voices from across Asia and the Pacific. So, open the door and let's settle into a conversation to see how together we can build a world where everyone has a decent place to live. Hello and welcome to this episode of Open the Door, a podcast by Habitat for Humanity. When we think about health, most of us think about hospitals or medicine, but there is something more fundamental that shapes our health every day. Our home. The air we breathe, the space we have to rest, somewhere we can feel safe. These all contribute to our health, yet we rarely talk about housing in this way. I'm Jo Hayes, CEO of Habitat for Humanity Hong Kong and chair of our Global Housing Opportunities and Mission Engagement Strategic Advisory Committee that exists to bring together diverse voices from across our global network. I came to this work because I care deeply about addressing the inequalities in the systems that prevent people from accessing a safe, healthy, and affordable home. I'll be moderating today's conversation on the intersection between housing and health. Across countries, the details differ, but the pattern is the same. When people don't have safe and decent housing, their health suffers. Today, with my colleagues working in Asia and beyond, we'll discuss how that intersection looks different in every country. From poorly ventilated homes in tropical climates like Indonesia, to cold and damp housing in Auckland. Different places, same issue. In this episode, we'll talk about how homes are designed and regulated, how we improve existing homes, and how wider systems and partnerships shape what is possible. So let's meet our speakers and begin the conversation on housing and health. Hello and welcome, Alan and Scott. Great to have you here. Today, we are joined by Alan Thorp, CEO of Habitat for Humanity New Zealand, and Scott Merrill, Senior Director at Habitat's Terwilliger Centre for Innovation in Shelter, TCIS. I want to start with what happens to people's health when housing fails and why this conversation is so urgent right now. But let me ground us in some numbers first of all. So global research, including Habitat's Home Equals work, shows that within a single year, improving basic housing conditions in informal settlements could prevent over 20 million illnesses, reduce more than 40 million cases of gender-based violence, and save over 80,000 women who might otherwise die during pregnancy or childbirth. The impact is significant, and it's also very practical. Simple changes like access to clean fuel, safe water at home, or a private toilet can dramatically reduce illness and improve safety, especially for women. Some of the biggest gains would be seen in places like India and Bangladesh, where dense urban living conditions amplify these risks. But numbers only tell part of the story. In Hong Kong, where I work, we can see very clearly how housing and health are connected. It's a dense city with 24% of the population living below the poverty line and a rapidly aging community. There's a wide range of living conditions, including subdivided flats where single apartments are divided into very small spaces for multiple households. Lack of ventilation, rodent infestations are common issues that we're tackling right now. These environments can really impact people's health, well-being, and dignity. So I want to hear about the context that you're both working in. Let's start with you, Alan. So you run Habitat New Zealand, and Healthy Homes is one of the most well-known programs across the network. You joined Habitat more than 18 and a half years ago. But what compels you to stay, and how does housing and health interlink in New Zealand?
Yeah, great questions. It's Habitat for Humanity, and for me, it's the humanity part of the Habitat that actually compels me to stay working for Habitat, because I believe that all humans are valued and deserve respect.
Yeah.
And of course, housing is a core foundation of that. And I fundamentally believe that housing is foundational to a functioning society. So if we don't have our housing correct, then our societies will be falling apart. So housing is so important. So that's why I stay with Habitat for Humanity. Yeah. New Zealand's quite an interesting case study, because we built a lot of houses in the 1950s, and we didn't build them very well. We didn't include proper insulation or proper ventilation. And so we had a lot of population growth happening in that. And just for those of you who don't know, because I know some people don't know where New Zealand is, it is in the South Pacific. It's west of Australia. It's about the same size as Japan, and but it has quite a small population of about 5 million people. So you've recently been there, Scott, yeah. So I know you've enjoyed our landscapes, but we do have quite a significant housing problem. So we have this sort of cold, damp, it's not tropical heat, but we have very damp conditions. So we have a lot of bronchitis and lung type pieces, and specifically in a developed country like New Zealand, we were surprised in the late 1990s to realise that we had a lot of rheumatic fever. So that normally occurs in less developed countries, and for New Zealand it was quite appalling to know that we had a big problem. So what happened was that the health ministry at that point in time decided that actually it was no point in just trying to address this at the health aspect of it, but that actually it was the housing that was causing the problem. So under the health budget, the government began this program called Healthy Homes Initiative, and they began to look at the homes. So when people would present in a hospital with lung issues, rheumatic fever, they would then go back and have a look at their home, and they would do a healthy home inspection. So did it have the proper insulation? Did it have the proper ventilation? Were there too many people living in the home? It was quite a good initiative because it was under a health budget, but it was a housing related outcome. So Habitat for Humanity has been able to intersect with that incredibly well. So we actually deliver some of those programs of healthy home inspections. So we do go into people's homes and we inspect their ventilation, their insulation. We look at the mold on the walls. We give them education about how they can make their home more healthy, and it can transform that home, and then obviously reduce the number of hospital visits.
That's incredible. So that's actually changing behaviours as well, and changing mindsets on, and empowering the people to actually make changes themselves in their own homes.
It is, and it's very much though how the house has been built,
yeah.
and what's there. So you can retrofit a house,
yeah.
But again, so subsequently the New Zealand government has changed its policy too around ensuring that we do have proper ventilation and also proper insulation. So those two things are really important. Yeah.
I'd love to, in a short while, come back as well to kind of that government partnership and how we can change at the systems level as well. But really interesting, and also in Hong Kong we can relate because we have such high humidity, and mold is such an issue there as well.
If I can give an example,
yeah, please.
One is in Auckland where we went into a house and the hot water cylinder had burst. They didn't have the money to fix that leak. The floors were all rotten, and this was a house that the family owned, but they had 3 children and they didn't have any money to fix it. I walked into that house and I couldn't believe that it was only 30 minutes drive from where I live.
Yeah.
The walls were full of mold on all of the walls. The curtains were all moldy. The floor was completely rotten, so they had planks that they were walking over the planks.
Wow.
And the kitchen was derelict. And those 3 kids were going to school. They were trying to function as a family. And, like I said before, if housing is foundational for a functioning society, these people didn't have their foundation right. So through this Healthy Homes Initiative, we were able to go in. we're able to get the proper insulation for the home. We fixed the exterior leaks on the exterior of the house. We fixed the floor. We took all the mould off, made sure that there was ventilation that was properly going into the house. And we also have a curtain bank. So we were able to replace the curtains and fit them with properly lined curtains, which keep the heat into the house. And so that house is now a livable place for that family, which has transformed that family's life.
That is totally transformational. Really, thank you for sharing that example. Maybe, Scott, I can come over to you. You lead regional operations for the Terwilliger Centre for Innovation in Shelter, TCIS, we'll call it from now on. And TCIS is doing some of the most ambitious and innovative work in housing markets that's out there. Can you tell us in plain language what TCIS does, and how did you personally find your way to housing? What's your journey and your story?
So, yeah, I guess in plain language, what TCIS does is try to make it easier for people to build their own homes.
Right.
So we know that about 1/3 of the world lives in inadequate housing. Most of those people are using markets to buy the materials, the labor, the financing that they need in order to actually build their homes. And I think a lot of us who are more privileged, we think of how we got our home, right? So I'm from the US originally. So what does that mean? It means that when I went to go buy a home, I found a house that I really liked that was already built, and I got a mortgage, and I didn't have to think about how that house was constructed, other than getting it inspected and making sure everything's okay. But I have a 30-year mortgage, and it allows me to pay that off over time. Most people, particularly in developing and emerging economies, are building their homes themselves, and they're doing it without support.
Right.
So they're going and they're buying the materials, they're hiring their cousin, they are saving little bits of money, maybe borrowing a little bit from a microfinance institution and diverting some of that loan to make a home improvement. And it still takes them 30 years. It's just for most of that time, they're not living in a fully finished house. And so the role of the Terwilliger Center is, how do we help those people build their homes better and build their homes faster so that they can live in adequate housing in a much shorter amount of time.
Right.
And then, so in terms of why is that important to me, why does that work call to me? So prior to joining Habitat for Humanity, I worked mostly in economic development programs, so livelihoods and agriculture programs, and really focusing on how do we help people around the world graduate out of extreme poverty. And one of the things that I noticed is a lot of times we would use home improvements as kind of an informal proxy for somebody who's doing really well, right? Who's obviously now they're earning more money through whatever their small businesses that they've started or through their agricultural activities, and so they put a new roof on the house, or they expanded their home by adding an additional room. And so what really kind of struck me around when starting to think about housing is that we were really focused in these programs around helping people build assets. What we were never talking about, though, was the biggest and the most important asset that they will ever own, which was their home.
Right.
And so when the opportunity came to take some of the tools and approaches that I had worked in agricultural programs around promoting market access and availability, and to apply that to housing, I jumped at the chance, because it was, to Alan's point, right? I mean, if we don't get the housing right,
Yeah.
that is the foundation for everybody's life, not just for that household, but also for the community. And it really sets a person's place within their community and gives them the dignity that we all should have.
What I'm really finding interesting about what you're describing is how housing is actually the foundation of so many aspects of our life. So, Alan, maybe let's come back to you and to really hone in on that intersection between housing and health. You touched on it already earlier, but many people think about health as something that is when you go to see a doctor. But increasingly, the evidence is pointing to home itself. How is this become more evident in New Zealand? Can we expand a bit on what you were sharing earlier?
Yeah, so I think we've had some recent surveys done in New Zealand that show that there's approximately 200,000 homes that don't meet the Healthy Homes standard that the government submits, and so a lot of our homes are not up to standard, right, which then goes through to our hospital admissions. So 1 in 5 admissions to hospital for those aged under 19 years are related to healthy home issues. And an example of this is, an example that I like to use often is a story about Tammy, who lives in Rotorua, and she was living in a state home in Kaurara, and which was not far from Rotorua, and the home was cold, it was damp, it was never built properly, and she had a desire to change her circumstance. By the time her child was aged 6 years old, she'd had 300 hospital visits through respiratory issues. So that's what I was talking about before. This massive presentation at a hospital that was a direct result of her poor living conditions. So Habitat for Humanity came along and we offered her a home that was decent and safe and affordable and healthy. And it transformed her life, so much so that I sat around her table, and she was going off to do further education to become a social worker, and her children were thriving and going to the local school, not having days off. And she said to me, "Look, Alan, I want to stay here until I die. I want my coffin to be in this room, and this house is going to be here for my children and my children's children, and it's going to be the foundation for our life." And so, and again, an example of the fact that housing was foundational for her. Yeah. So New Zealand, we've been a bit cheap in the past. We've built our houses cheaply and poorly. We are trying to rectify that. It's quite difficult, but we generally recognise that yes, there is a significant connection between housing and health, and if we want to reduce our health budget, we actually also need to focus significantly on our housing budget.
Mm. And so the government are actually making changes. They're actually really making a difference, right?
The government's making changes. Yeah. Interestingly, they have increased the insulation significantly, but not quite done the same thing for the ventilation. So we're now having alternate problems where houses are getting too warm. So again, these things are not straightforward. They have to be really thought through really well. But I think the overall increase is far better for people's health than what we've had.
Yeah. We actually have something similar in Hong Kong where a few years ago we were talking and advocating for improved living conditions in subdivided flats that we have. And the government in Hong Kong has actually mandated now that the living conditions be improved, and new regulations have just come in. They're really making a difference to the families that are living in very cramped spaces and cockroach and rat infestations. So and being able to kind of see how policy can actually change people's living conditions, see that in action is really encouraging. Can I come to you, Scott? So we're talking about countries and places with healthy home standards. Alan is describing where the policies and regulations are already seemingly established or being further established. But in a lot of markets that you work in, that policy scaffolding doesn't always exist yet. So what does TCIS do to frame what is potentially broken or isn't there in the first place?
So let me tell you about Kenya.
Yeah.
In Kenya, we're trying to work towards something like what Alan described in New Zealand, but around a very different type of health risk, which is malaria. I think most people, when they think of malaria interventions, they think of bed nets. I think that's the most famous one. They think of spraying of pesticides as another alternative. And what we had a question about 4 or 5 years ago of saying, what could we do from a housing perspective to make it more likely that people sleep in bed nets that help to keep the mosquitoes out of the home in the first place? And so we ran a crowdsourcing global competition for ideas around how do we retrofit existing traditional mud homes to keep mosquitoes out of those homes. We then partnered with the Kenya Medical Research Institute to test a handful of the winning designs that came through, and there were some really innovative ideas. And what was actually quite interesting from my perspective was, at the end of the day, we realized this really isn't an engineering challenge. It's not a design challenge. It is a challenge of how do we take existing really simple technologies, screened windows, adding windows in the first place, screened eaves, having eaves in the first place that'll allow airflow and help make the home cooler, cool roof painting, a reflective paint to keep the house cooler at night, because it doesn't get so hot during the day. And these are not very expensive interventions, but they're not regularly available in sort of the traditional ways that people are building. And so one of the things that we're looking at is how do we stimulate enough demand for these types of retrofits so that hardware stores will sell screens in those communities, so that financial institutions can design loans for someone to borrow $200 to add windows and screens and doors to their home. How do we understand how people, what are people's concerns around security and safety related to having windows? And then how do we help to allay those concerns? And we see actually the potential for the health ministries to be a really important part of that. So we've continued our partnership with KEMRI, the Kenya Medical Research Institute, which is a government research institute. And we are working with them to test these innovations. We've tested them in controlled conditions. We're now testing them in the real world. And we're really looking at not just how the solutions work in the real world, but how the communities interact with those solutions and what might help them help to drive demand for those solutions. And we're looking into the possibility of, with government health budgets in many countries, particularly in Africa, declining due to reductions in development assistance, there's an opportunity to maybe take some of that declining money that's being used on recurring interventions and trying to stimulate demand for these types of interventions. So maybe there's a way to apply for some subsidies for demonstration homes, and then we help the government to build the infrastructure and knowledge base around the, again, very simple, relatively low cost home retrofits that will help to keep the mosquitoes out of homes and help ensure that people use the bed nets that they have as well.
There's so much that I want to pick up on that you've said that's really interesting. The way that you're framing the housing ecosystem and thinking about all of the different players in that system, from creating that demand to be able to actually change the way that people can think about mosquitoes, something really fundamental, but that can be potentially life-changing.
When we're looking at how people build, right? So we really want to come at it from understanding why people make the decisions to build the way that they're doing. Because if we're hoping to influence those decisions, it's not us coming and giving them the information. There's other reasons why they make the choices that they make that are rational choices for them. So we really think about it, oftentimes there's 4 gaps that we see in these markets. The first gap is often a capacity gap. Capacity of the homeowners, they don't really know the best way to do it. The capacity of the informal laborers that they hire, that have kind of learned on the job, never had any formal training. There's usually not an architect or an engineer that is involved in providing advice due to cost potentially, but also it was some of the people that we talk to. They don't feel like those types of people, the educated engineers and architects, want to provide services to people like me. So there's this capacity gap. There's then, I would call it a demand gap.
Right.
In part because people don't know. They don't necessarily aspire to having that particular, whatever the better way of building is. There's a financial component of demand as well. So there's an aspirational component and there's a financial component. And it's about, when we think about what's going to really drive the changes, it is how do we generate that demand for whatever the changes are that we're hoping to see in the market. And so with the malaria example, it's how do we drive the demand for screens and better ventilation and cool roofs, and what are the factors that will want people to make those investments. And then there's the supply gap. And within the supply gap, a lot of times the materials aren't available, or if there are materials available, they're often substandard, counterfeit, or they're available but only in the high-end hardware stores and not in the communities where
Right.
people are actually building their homes. And so how do we, once you have enough demand, then how can you get the supply down so that people can access the materials that they need in order to build their homes? And then finally, there's the regulatory gap. And regulations may exist, they may not always be enforced. There might be different ways, particularly if you're talking about introducing more innovative construction techniques or technologies. There might be barriers for approvals of those technologies. And so how do we address whatever the regulatory constraints are? And so in any market that we're looking at, we're looking really across those four different constraints in order to design the portfolio of interventions that we have in order to try to work towards ensuring that the people can build the homes that they want to live in.
Thank you so much for breaking it down in these terms, because it just goes to show the complexities around housing, but also the intersection with health as well, and all of the different gaps that you've described. Being able to go in and understand those rather than kind of missing one component. It seems that everything needs to work together to be able to come up with something that is a pretty simple but life-changing solutions. So let's zoom out here and think about the bigger context, maybe some of the structural challenges, and let's talk about the regional perspective. We've heard stories from Auckland and Kenya and Hong Kong, but what about the Asia and the Pacific region specifically? What do we think is making this work so hard? And are there ways that we think that our region is different to other regions in any way? Scott, let's start with you.
Yeah, I think from my perspective, the biggest challenge is the changing climate.
Right.
And it is requiring people to think differently, potentially, about how they build, because there's different hazards that they face. And I think a lot of people, when they think of the changing climate, they think of worsening storms. But I think something that is often underlooked, or overlooked, I guess I should say, is the change in heat and the rise of extreme heat in many of the countries that we work in Asia. And so a focus on how do we keep the home cool so that people will want to stay in their homes, because as we know, most people, particularly women, are at home during the day. How do you make it comfortable and safe for them to stay in their home? We're doing a lot of work in terms of testing different types of interventions in various countries around how do we actually lower the temperature in homes with different types of designs, but also simple things like roof paint, which I mentioned in Kenya. We're also looking at that in a place like India, and we're doing research to understand, okay, with this different paint, for instance, what is the actual change in temperature inside the house that someone will feel by having, we'll put thermometers in that we monitor the temperature of the house over the course of a week or 2 weeks to understand, once they have this new roof, what does that mean for the temperature inside. And we're really finding that it is making the home more comfortable, not just during the day when it's at its hottest, but also at night as well, because there's less stored heat in the structure. And so then people are more likely to sleep inside where it's safe, as opposed to spending time outside where it may not be as safe in some of these communities.
You do some really cool work. Like, you are really at the forefront of innovation and finding solutions that must be very exciting to see how these kind of innovations can make these changes.
Yeah, it's what gets me up in the morning.
Right. Yeah, and actually similar research being done, and people finding ways to kind of monitor movement in the homes in Hong Kong, because we're going to be experiencing extreme heat in a few years' time as well, and it's just going to be untenable for many people where they don't have the luxury of aircon, and experiencing extreme heat in the home is an issue.
Yeah.
How about for you, Alan?
Yeah, so I mean, there's an interesting overlap here because Habitat for Humanity New Zealand's partnering with Auckland University, who are partnering with Heidelberg University, and they're doing a study that's a global study in this very piece around cool roofs. It's called the Reflect Project.
Reflect
Project, yeah. And a fairly small intervention, say a couple of $100 on someone's roof, could make a huge difference. So they're actually working towards publishing a scientific study, which will show that actually this intervention will actually reduce the temperature, which increases the health outcomes for those in the household significantly. So we're really excited to be part of that and to have the overlap. I think probably going back, I mean, this is the really cool thing about TCIS and the market systems approach. I think financing is a problem for every government. In New Zealand, with our Healthy Home initiative, we have a bank which has lent us $5 million interest-free, and we rotate that over, and we help families through that process. So there is ability for corporates to get involved, but obviously the best way of approaching this problem is to have a market systems approach, whereby you can actually create the market, and the market itself corrects itself in the process. So I think that's probably one of the biggest things that this region needs to think about and how it processes it, because governments don't have the money to do the interventions themselves.
Yeah, we do. We absolutely need many partners coming in to play here, right? Yeah. We can't just expect one, whether it's government or community or corporate. Everyone needs to come together to work with the communities, right?
Yeah, and it, I think it's also just important to remember again that people are already using the market in order to build their homes. It's not efficient. And so, in this region, we expect about 70% of new home construction to be built informally and incrementally in the developing and emerging economies that TCIS works in.
Sorry, what is incremental?
So that's the process that I mentioned earlier, where people are building their homes bit by bit over time. So you start with, maybe you have one room, you're slowly expanding it, you might add a second room, you might eventually, you plan on going up 1 or 2 floors. Oftentimes, I think when you travel to some of these countries, you see the rebar sticking out of the roofs.
Yeah.
That really is a signal of an intention, of a hope to be able to build an additional floor in order to expand the home. So that's saying we're not satisfied with where we are right now, but we have plans to build more. And so the question is, how do we help those people build better and anticipate the threats like extreme heat that they might not be able to even be aware of right now, but that will require relatively low fixes, and there are market solutions available, and it doesn't require a government or an NGO in order to come and do the work for them, because we can't do this all ourselves.
Yeah. And it's, I guess it's about being able to adapt, right? And as our health needs evolve, as we get older, or, we need to adapt our living conditions. And so that's one way of doing that. So tell us a little bit more, Alan, about the Pacific in particular. What are some of the challenges that are so relevant to that region? the work that you do there.
Yeah, so Habitat for Humanity New Zealand works in Fiji, Samoa and Tonga. In Fiji, 25% of the population are in informal settlements. Housing conditions are pretty poor. In fact, there's a huge amount of poverty. I was recently in Tonga and was completely taken aghast by the fact that a family had not eaten food for 5 days. Unbelievable poverty. And housing conditions are along those lines. But, those communities are also facing significant change in cyclones and weather events which actually impact their housing. So Habitat's doing these interventions around cyclone proofing their houses. But one of the other big things around health for those people as well is that they don't have proper wash facilities, water and sanitation and hygiene facilities. So recently we were in Tonga and a man, Sione, who was unwell, I went to his home and what he was living in was a shack. I could only describe it as a shack. Bits of tin around some pieces of wood on the ground. And he was unwell. Through our program, we were able to build a home, which was 6 meters by 4 meters, relatively small, but it had a separate toilet and shower unit and a septic tank that was installed.
Wow.
So where he previously had no wash facilities, he was now having hygienic wash facilities. So in terms of his health, the outcomes for that family improved significantly through the intervention of wash. And so that's one of the things that Habitat for Humanity is doing across the Pacific.
Yeah.
Includes installing water tanks, getting drinkable water from the roofs, and also maintaining that water across the dry seasons is important when you can put it into a tank. So that's some of the work that we're doing in the Pacific. The other interesting thing that we're doing in the Pacific is we're doing specific training for women around plumbing.
Right.
So you quite like this, Joe.
Yeah.
In the Pacific, lots of the men leave and go and pick fruit in New Zealand. They're called regional service workers, and they come to New Zealand and do that. But they leave their families for 3 or 4 months of the year. And often, stereotypically, maybe the women don't know how to do the plumbing or fix it. Something happens. And so we're able to help them, teach them how to fix their plumbing if something goes wrong, so that they continue to maintain their water and sanitation and hygiene facilities while the men have gone. So that's something that's quite innovative too.
Well, this is a bit of a side note to health and housing, but I think really important how we are actually helping to train women in masonry skills as well, and to be able to build homes and address gender pay gaps. It's work that we've been doing in Nepal that I was able to see firsthand. Incredible stuff that's happening across the region. So, looking ahead, what are some of the ways that we need to come together and find solutions, and what's next? What I'm noticing about our different context and what we're sharing, and one thing that keeps coming up is how one system starts paying for the work of another. So in New Zealand, the health budget started paying for housing inspections, right? And in Kenya, the malaria budget could fund retrofits. In Hong Kong, public policy is starting to fund design for health and integrate well-being into the design of new housing. But what does that pattern tell us about where the region is and where we need to go next? Scott, what do you think?
For me, the really exciting thing for me is some of the things that we're working on right now. They're relatively small scale, but the potential is so huge, right? So in the Philippines, we are starting to work with a municipal government on fire safety, and we are working with that municipal government to think through the different ways that they can address the poor quality construction and the electrical wiring systems in most of the informally built homes. And again, there's a capacity gap, supply gap, demand gap, and regulatory gap. There's a lot of counterfeit electrical goods.
Right.
How can we help the municipal government think about certifying that this store has high quality goods. There's a lot of poorly trained or not trained at all people who are electricians. How do we help the municipal government be able to signal that this is someone who actually knows their things? That's not going and getting a certificate, because nobody's going to want to go pay for that. But how do we get them to be certified on the job? So we're trying to test some of these different approaches that, again, where it's the government itself is not providing a lot of the money per se to the household. They're providing is the signals to the household is this is where you should put your money. And then we'll work with financial institutions around, and this is how you can design products to help people, because now we know there's a lot of demand for these types of retrofits, and we can prove that based on how many people we see are doing making those types of investments. And the idea is to prove that in one area, and then we can look at how do we take that national. And that's exciting.
Very exciting. We're actually doing something similar about how to prove a concept in Hong Kong with our aging in place work. So really seeing how we can prevent falls in the home and do really simple retrofits where people can avoid having a fall, and then the impact that has. And then we were talking earlier about the ripple effect, but the ripple effect on the health sector itself. Really interesting work that's happening. And how about you? What's your thought there, Alan?
I suppose for me in New Zealand, it's the Healthy Homes Initiative, which has it's got a great start. It's in a good place, but it can be increased and widened, and specifically targeting Pacifico and Māori to reduce the inequities in our society. I think that's a really important piece. So that's something which motivates me. A healthy home and an adequate home is foundational to a functioning society. So we can't necessarily build new homes. We have to do a whole lot of retrofits, and there is opportunity for us to change with not too significant, with relatively small interventions can actually make a huge difference. So for me, that's where we should be placing our investments.
And we touched on earlier already about how important it is for so many different players in the housing ecosystem to come together to find solutions. Tell us a bit more about some of the corporate partnerships that, Alan, how corporate's helping.
Yeah, so for in New Zealand, the Bank of New Zealand, BNZ, is a corporate partner of Habitat for Humanity, and it's given us a $5 million line of equity, which we can just draw down on, and that's interest-free. So we can loan that out to families at 0% interest for a period of 5 years. And of course, they need to be able to repay that. But the BNZ have also underwritten that. So we've got good systems and processes in place. We've had no defaults in those loans so far. But that $5 million can then just be revolved and used over and over and over again. So it's a really good example.
Interesting model.
Yeah, of a corporate partner who's willing to obviously give us that line of credit. They want to do good in the community, and it's part of their corporate social responsibility. But it's something that we're utilising specifically for healthy homes.
Yeah, I think that's where you see most change happen, isn't it? When you do have that values alignment, and where corporates really want to focus on the community and listening to what the community needs, that's when real change happens. Interesting model. Thanks for sharing that one. Let's go more broadly then. So what call to action have we got for any of our listeners, whether they're corporate partners or individual donors or people just wanting to help? What would you ask them to do this coming year?
Yeah, so I think everything that the TCIS does is through partnerships. But I think one of the things that we bring to those partnerships is an understanding of how these lower income housing markets work that a lot of people aren't aware of. And even people who are in the housing and the construction space. I met not too long ago with a CFO of a large cement company in Latin America, and I was like, well, why do you want to work with us? And he said, well, about 60% of our product that we sell goes out and is sold in informal settlements. And we have no idea who's buying that product. how they're using it, what they're using it for. And that's a real business risk to us. And so that's why they wanted to come and work with TCIS, is for us to help them understand that market so that they could better serve the market. And so I think the call to action from my perspective is I want people to think about this as a market, right? I think the work that we do, we need funding to do the work that we do, but it has to go beyond charity to this is the way of doing business that makes sense, because it is the largest driver of housing, as I said earlier, is going to be these informal markets. And if we don't meet their needs, we're going to be exacerbating the problem of inadequate housing as opposed to addressing it.
Alan, would you like to add your thoughts on actions?
I think one of the actions I would suggest is that we continue to advocate to our governments around prioritising housing, but also not keeping it within the housing bucket, but to understand its correlation with health. And specifically, we're talking about health today. So, seeing it as a health outcome and using it as part of the health budget to do housing interventions, I think is something that we need to be advocating for. But then I'd also say, the market systems approach is really important, because that means that you can do things without having to pay money for it. So if a government can enable a market systems approach, so rather than being a barrier to that, how can we help enable that to happen, I think is a really important call out.
I briefly touched on wellbeing design being integrated into the design of new builds in Hong Kong. But I think this is a really great example, and it builds on what you're saying, Scott, about and Alan, about governments and the role that they play. So in Hong Kong, the Housing Bureau championed a project that brought together so many different stakeholders. Habitat was one of them, to think about the well-being of the community living in public rental housing, and how to integrate their well-being and their health needs and their evolving health needs, as we have an aging population in Hong Kong. But for everybody, universal design, how to integrate that into the design of housing. But it's not just the governments, like they need to be the champions, but the developers then need to play their role as well. And the community engagement is such an important part of doing that. So I think for everyone listening, being able to get to know housing more, to understand what the connections are and how housing is at the foundation of so many aspects of our lives. I think that awareness can only bring about better solutions. Thank you so much. We're almost at the end of our podcast. I'm really sad that we're coming to the end of it, but I do have a couple of closing questions. We've got a bit of a lightning round. I'll start with a couple of standard questions and then throw in a couple of my own. What comes to mind when you first hear the word home? Scott?
Safety, yeah.
Baking.
Oh, when are we being invited over to your home? Finish the sentence. Through housing, we open the door to...
life.
Loving family.
Oh. Again, when are we coming over to your home? I'll throw in a couple of my own. Kitchen essential. What's the one kitchen item that you couldn't live without?
A sous vide machine.
Ooh.
Yeah.
Something to do with baking, I'm guessing.
No, a KitchenAid.
And let's go back in time before we think about the future. Do you have a first home memory? What's something that you remember about the home that you grew up in? I'll flip it. I'll start with you, Alan.
Yeah, it was a two-storied home and had a little deck which I used to throw paper darts off. I was the youngest of 5 kids, and it was a 3-bedroom home, so shared a bedroom with my sister, but it was warm and cozy and dry, and it was beautiful.
We moved around quite a bit as jobs changed for my folks. So I became very comfortable with wherever we were together as a family, as that being defined as our home.
Yeah. I can relate. I've moved around all of my life, and where I am now in Hong Kong is the longest I've ever lived anywhere, and that's definitely home for me. I think home is, as you're describing, it's the people, but it's also about all of those different aspects of life that come together, and having home as the protector, as the safe space, as somewhere where we can live in dignity. Well, that brings us to the close of the podcast. I'm really sad that the conversation's ending here for the three of us, but it will continue outside. But thank you so much for joining today, and see you soon.
You're welcome.
Thanks.
Thank you. Thanks for joining us on this episode. We hope you enjoyed this conversation on housing and health. We've heard human stories of the transformational benefits of housing on families' and communities' health, on their well-being and their dignity. We've also heard solutions and opportunities to scale them. So we hope that you join us for more honest and insightful conversations on housing in the coming months. Thanks for opening the door with us today. Follow and subscribe so you never miss an episode. To learn more about Habitat for Humanity's work in the region and to find out how you can get involved, visit habitat.org/AP. and follow Habitat for Humanity Asia Pacific on LinkedIn, Instagram, Facebook, and YouTube.